There are 105 active cases of coronavirus in Victoria, with 5 new cases since my update yesterday. Those 5 cases are linked to known outbreaks, and 1 case was reclassified. There are 9 Victorians in hospital, and none of those 9 patients are in intensive care. A total of 3,002,936 test results have been received since the beginning of the year. That's an increase of 18,442 since yesterday. We thank each of those 18,500 people for what is a profound contribution to our fight against this virus. The most complete picture and an appropriate public health response to stop the spread of this virus is essential to the opening up that we all desperately want to do next week and in the weeks to follow. So we're very grateful to each and every one of those almost 18,500 people. There are 8 healthcare workers who are active cases. The rolling average to 21 October is Metro 6.1 cases, Regional Victoria 0.4 cases, and the total mystery cases to 19 October are 10 in metropolitan Melbourne, none in regional Victoria. Of the 5 cases today, they're obviously all in metro areas, 4 in Hume, 1 in Banyule local government areas. There are just 3 of those 105 active cases, just 3 are in regional Victoria, and they are the 3 cases in Greater Shepparton that we've reported on consistently for recent days. There are now just 5 active cases linked to residential aged care, which is a very pleasing result given the vulnerability of that sector. Now, Jerome has joined us as the testing commander. Alan is here as Deputy Chief Health Officer, and they'll speak in more detail about that northern metro, those clusters and that outbreak, and the excellent public health response that has been brought to that very challenging set of circumstances. Testing, we always say this because it's simply perhaps the most important fact. Testing is critically important, particularly when we get outbreaks. That's what was so successful in Kilmore, it's what was so successful in Shepparton, and indeed Chadstone and other outbreaks that we've had in recent times. To that end, can I send a really clear message to those in northern Melbourne, northern metropolitan Melbourne? There are a number of sites that are set up for testing. I'm now going to read through those. All of this information can be further explored around operating hours and exact physical addresses on the website. But if I can just take you through: Broadmeadows Central Shopping Centre, Coolaroo Respiratory Centre, but that's by appointment only and only for symptomatic testing. Melbourne Airport drive-through testing site, Craigieburn Health Service drive-through, Roxburgh Park Youth and Recreation Centre, that's a drive-through as well. 29 Timmins Street in Sunbury, that is a walk-up site. Highlands Hotel is a pop-up site at this stage for today only, but we'll have further information if that needs to be extended.